In this video, I will go over different fungal infections starting with the aspergillus. So aspergillus forms a fungus ball in preformed lung cavities. For instance, if a patient had tuberculosis, as a consequence of which there was a lung cavity formed, then the aspergillus will form a fungus ball in that lung cavity. And on microscopy, you will see septate hyphae at 45-degree angles, shown here in this image. And then the clinical presentations include allergic bronchopulmonary aspergillosis, where the patient will show hypersensitivity with increased number of eosinophils. And then in patients that are either neutropenic or have chronic granulomatous disease, following the nasal colonization, the aspergillus can cause pneumonia or meningitis. And then finally, aspergillus can cause cellulitis in burn patients. So cellulitis in burn patients. The next organism is blastomyces, and you can use the mnemonic B goes for broad-based budding yeast. So it's a broad-based budding yeast that is most commonly found in the eastern states, and the infections present with the granulomatous nodules. The next infection is coccidiomycosis, also known as valley fever, and it presents with spherules that are filled with endospores. And you can use the C as a mnemonic to know that coccidiomycosis is found in California deserts and is associated with the formation of calcified lesions. So C goes for coccidiomycosis. And this infection usually causes a self-resolving pneumonia, but then in AIDS patients or during the third trimester of pregnancy, coccidiomycosis can disseminate. The next infection is histoplasmosis, and histoplasma can present with flu-like symptoms as well as hepatosplenomegaly. So histoplasma is usually found in bats or birds' droppings, and then on the peripheral blood smear you will see macrophages that have engulfed the histoplasma. So you can see the histoplasma inside. Note that histoplasma inside the tissue has no capsule. And then the environmental form of histoplasma presents with hyphae and conidia. So here I would like to review the map with you. So here on the map I've marked the Missouri states, and I mentioned that blastomycosis presents in the eastern states, so the distribution would be something like this. And that is for blastomycosis, which is a broad-based budding yeast. And then for histoplasma, which is found in the riverbeds of Ohio, Missouri, and Mississippi, the distribution would be more like this. And finally, for coccidiomycosis, which is found in the deserts, the distribution would be something like this. Now back to the topic. The next organism is Mucor and Rhizopus, which is found in leukemic or diabetic ketoacidosis patients, and it can cause a rhinocerebral infection. So from the cribriform plate, the fungi can infect the brain and cause a black necrotic eschar. The next infection is Cryptococcus neoformans, which is a heavily encapsulated yeast. So here you can see that it's heavily encapsulated. And it can be stained with the India ink and is commonly found in the pigeon droppings and is a common cause of meningitis in AIDS patients. So if you have signs of meningitis in an AIDS patient, you can obtain the CSF fluid and then stain it with India ink or label it with the latex particle agglutination to look for the capsular antigen. The next organism is Pneumocystis jirovecii, which is commonly causing pneumonia in AIDS patients with CD4 count of less than 200. And then the presentation is a patchy infiltrate with the ground glass appearance on the X-ray. And once you obtain a bronchial alveolar lavage of these patients and the silver stain, so you will have to use silver stain, you will see cysts that are having a disc-shaped appearance. So here you can see cysts with the disc-shaped appearance. The final organism is Candida albicans, and it can present in multiple different forms. It can present as budding yeast, with true hyphae, pseudo hyphae, or germ tube. So on the exam, if you see a yeast that is having pseudo hyphae or germ tubes, it should make you think of Candida albicans infection. And then the Candida albicans cannot cause any infection in normal individuals, but patients with T-cell deficiency, like HIV patients, can develop oropharyngeal candidiasis, which is shown right here. And then you will have to treat them with either the nystatin, swish and swallow, or treat them with the fluconazole. On the other hand, diabetic patients, since they have a weakened immune system, or during pregnancy because of the hormonal imbalance, or because of the long term of the antibiotic use, which causes destruction of the vaginal normal flora, these patients can present with vulvovaginal candidiasis, which can also be treated with fluconazole. And then finally, if a patient is neutropenic, then there would be a systemic infection with the candida, which needs to be treated with amphotericin B, fluconazole, or caspofungin. And that concludes our discussion.